All right, so the story we're going to tell today is about our patient Daisy Duck. Now, Daisy is a resident of Humboldt County in Northern California. She lives in Garberville, California, which is just on the border between Humboldt County and Mendocino County, so southern border of Humboldt County. But she has family that lives in Oregon. She goes to visit them. She has some shortness of breath issues while she's visiting them and a little bit of edema in her legs. She goes to the hospital. They admit her to the hospital and find that she has new onset congestive heart failure. Keep her in the hospital for a few days up in Salem, Oregon, and they discharge her with instructions to follow up with her primary care when she arrives back home in Humboldt County. So she calls her primary care, Dr. Sunshine, California, when she gets back to home, and she makes an appointment. She lets me know that she was seen in the hospital. She was inpatient at Salem Hospital up in Oregon, and I then say, well, okay, that's great. Come in on the 8th and we'll discuss it. In the meantime, I'm going to go and get that discharge summary from Salem Hospital. So the first thing that I do is go to my instance of Direct and I open up my provider directory. Now, it normally just searches my local male HPD, which is my local provider directory, but I'm going to add in the California directory, which by my training I know searches not only the HIMSS in California, but it also searches the HIMSS in Oregon, Alaska, soon to be Nevada and Utah, and a number of other Western states. So I know I'm going to get a pretty complete search here. I'm going to type in the word Salem in the name search and just hit the search key. Now normally this search is going to be a lot faster. Right now we're making a ton of logging, doing a ton of logging on these searches. But it does come up. The local mail finds nothing, but I do find Salem Hospital medical records. So here's their direct address. If I click on it, I can click Compose. And I can send a request for records. Just so nobody has to watch me type, I do have a pre-composed message here. And this message just indicates that I'm asking for records on Daisy Duck with her date of birth, the date she was in the hospital, and why I'm asking for that information. So up in Oregon, they don't have to do anything more than send me the records back. So we're sending the message. In just a minute, my screen will let me know that the message was sent successfully. It returns me to my inbox. And by this processed records request message, I know that it made it all the way to Oregon. Now in Oregon, they received my records request. And just so that we don't have to wait too much for this demo, I can show you that the way that they normally respond is with this discharge summary. See attached discharge summary. I open up that discharge summary. It opens it up in a window in Mirth so that I'm not downloading anything to a temp file, because if I'm on a computer at a Starbucks or a local internet cafe, then I need to make sure that I'm not doing anything insecure. I can review that discharge summary, note that it is for Daisy Duck and that she's been put on 2 new drugs, lisinopril and spironolactone. She also has a course of amoxicillin that she's just finishing up. And she's got a new onset of congestive heart failure. Now I can download this document and I can bring that up and put it into my version of Practice Fusion. So I can go into my documents, upload that new document, pull that discharge summary in. I can let my instance of Practice Fusion know that it's a hospital record for Daisy Duck. And I can assign it to myself as Sunshine, California, and upload that into her file. Now I see Daisy Duck in the office on the 8th of March. She comes in, we add her new medications to the system, and we decide that it would be best if she followed up with a cardiologist and got a consult with a cardiologist. Because she lives in southern Humboldt County, right near Mendocino, I'm going to send her to a cardiologist that I've worked with before, Happy Heart in Mendocino. So once again, I'm going to return to my instance of Mirth Mail, and I'm going to look up Dr. Hart in the provider directory. I'm again going to do a California directory search for Dr. Hart. And what I'm going to see returned, if everything works right, and it will, I know it will, there we go, we get 3 results for Dr. Hart. We get a Glad Hart in Mendocino County. I also see a Robert Hart in Santa Cruz, which means I am hitting multiple HIMSS in the state of California. But here's Happy Heart, who I want to refer to. So I'm going to click Compose and grab my pre-typed message. I'm going to send a new patient referral over to Dr. Hart, and I'm going to attach the discharge summary that was sent to me by Salem Hospital. Whoops. And I'm also going to send Dr. Hart the visit note from today's visit. Also pre-generated. They're both in PDF form, so I don't have to worry about whether or not Dr. Hart has Microsoft Office or Lotus Notes or anything like that. So we send that message, we send it successfully, and once again, I know that it made it to Dr. Hart because I see that processed message. It made it all the way out to his HIMSS. Later I'll find out whether or not he's read it, but right now I know that it made it out there. Now also, I know that Daisy, she and I are talking, and she says, would you make sure to send a copy of today's visit to my Health Vault account, because my daughter helps me manage my health care. I'm old enough to know that I need some help. So if I go over to Daisy's chart, I can see in her chart where her Health Vault address is. We have it recorded. It's daisy_duck at direct.healthvault.com. Now, she's not going to be in my provider directory because she's not a provider, but I know that I can send things to Health Vault through my Engine HIMSS. So I'm going to send to daisy_duck at direct.healthvault.com. I can put in my email to her some information about today's visit, as well as I've already exported a copy of her continuity of care record from my EHR, from my Practice Fusion instance, and I can send that along to her. And I can now go out into Health Vault, and I can see continuity of care records that were sent to Daisy. And it should be here any minute now, I promise. Maybe not. We have been having a little bit of trouble because we've sent this particular CCR so many times to Health Vault that it now thinks we're just sending duplicates, which of course we are. But nonetheless, now what I will show you that it's easier to see without moving the camera is that when Dr. Hart receives the referral, he reads the discharge summary and notes that an echocardiogram was done for Daisy while she was inpatient at Salem Hospital. What he wants to get is a copy of that echocardiogram report. So he can go in, do a provider directory lookup just like I did, find Salem medical records. He can ask for a copy of that heart echo. What Salem Medical Records sends back to him is not only the echocardiogram report, but also the actual 4D echocardiogram MP4 file. It takes a minute, just a minute to download. And Dr. Hart is now able to view the 4D echocardiogram video for Daisy Duck. This means he doesn't need to repeat that echocardiogram, so we've saved some money because he doesn't have to repeat it. So our patient then has been referred to a cardiologist. She's followed up with her primary care. All of her medications have been reconciled, and we didn't need to repeat the echocardiogram, so we saved some money and we saved some time and coordinated care in the best possible way.